call is being recorded for future dissemination and use for other folks across the county who may not have had time to join this call today. The first thing that I want to touch base on is the updates to case counts and how we'll be reporting that out on this call. So instead of seeing things from July of the previous year or from August of the previous year, we're going to begin our case counts from July 20th of this year. And you'll hear a report out from July 20th to current date. We may shift that date to July 1st. We're still having some internal dialogue about what that looks like. But at this point, we're going to use July 20th as the start date. So that being said, we currently have 70 cases. There are 64 confirmed, 6 are pending MedSys ID numbers, which means that after a case is reported, that there's a positive test result that gets recorded in the state database. So I'll repeat that one more time, 70 cases, 64 confirmed with MedSys ID numbers. There's 6 that are awaiting a MedSys ID number, which should potentially happen later today. Outbreaks are the other thing that we will be keeping a very close eye on. To date, we have 10 outbreaks that have been declared and 1 under investigation. So that's a really important statistic. If we will recall from last year, if you joined us on these calls, we had a total of 4,090 some odd cases for the school year, with a total of 66 confirmed outbreaks. This year, we are at 10 outbreaks, 10 confirmed outbreaks, and 70 cases. Again, 6 awaiting MedSys ID. So the proportion of outbreak to cases is something that's of particular concern. I think as a health department, we again want to reemphasize, we know you cannot mandate masks. We strongly, strongly encourage the use of masking at any indoor facility, even if you have been fully vaccinated. So regardless of vaccination status, and you'll see this from CDC updates, which have happened over the last 2 or 3 days, things are moving pretty quickly on that. We strongly, strongly encourage everyone to mask in indoor settings at this point in time, which brings us to the next stage of this quick update today. So CDC has been pushing out new emerging guidance. The health department is in the process right now of breaking some of that down and figuring out what that's going to look like for us in terms of our recommendations to you all. By next week, you'll see a couple of shifts. We're limited somewhat in terms of our legal authority. The one thing that we definitely can mandate is that if you have any positive cases, that those get reported to the health department. When you report positive cases, it's really important that you include a line list of all close contacts. This is not contact tracing. Pima County Health Department is the only organization that can conduct contact tracing. Contact tracing is the act of contacting an individual and guiding them into quarantine based on the close contact or proximity to a confirmed positive case. But in order for the health department to conduct contact tracing effectively, we do need to have a phone number, a date of birth, and a parent or guardian first and last name so that we can call that individual and then refer the individual into quarantine appropriately. Schools have done a really great job of this in the past by using the Qualtrics system. For the next week or so, we're going to continue to go down that path. There are some potential changes in the way that cases will get reported. We know that it takes a lot of time to enter Qualtrics forms. So we are looking at putting out a Excel line list that's already been formatted that you can then send back to us. If you are just joining us, I would encourage you to please mute your microphone if you're able. I'll try to do it from my end as best I can. But I am getting some background noise there. Let me see if I can just navigate through this menu and take care of that. Done. Okay. So just again, reiterate that again, the health department can mandate that you report positive cases, any positive case of student or staff to the health department. Please include a line list of close contacts with that report. If your line list exceeds 20 individuals, we would encourage you to reach out to us so that we can organize a KiteWorks drop delivery instead of using the Qualtrics reporting system, okay? Sherry, do you see the question in the chat? I'll get to that today for sure, because there's still a lot of sorting out those details too as things emerge. There's a few people that just joined us. I'm going to repeat some of the stats that we started this conversation out with. We have 64 confirmed cases, 70 reported cases from the 20th of July. We have 10 confirmed outbreaks, 1 under investigation at this point in time. So that's approximately 14% of cases in schools, more than that. It means that in-school transmission is significantly higher than last year. If there are no close contacts, do we still report a positive case to the health department? Yes, absolutely. If you have any positive cases that have been anywhere on your campus, any positive cases at all, we would like to make sure that we collect that information in a report so we can conduct case investigation. And the only mandate that the Pima County Health Department can do at this point in time is the reporting of positive cases. Great question, Tina. Thank you for that. Okay, so I want to guide through a couple of resources. Before we do that, I'm going to backtrack to Sherry's question because there is an important couple of things in there that you'll need to know about. Sherry asked if you could get an updated list of my team and their area of work, please. I am currently trying to hire and onboard more staff. For those of you that don't know, Kristen and Dixie both celebrated their early retirement from the county. Kristen's going back to Harvard to get their degree, and Dixie is engaging on the retirement dream with their partner. So we're very happy for both of them. Tiffany has moved on to a different position with a one-stop, so she's still with the county. And we are currently hiring for that position. In the meantime, Sylvia Vasquez will continue to work in Tiffany's role for case reporting, and Alva Guerrero, who is on this call today, we'll do a brief introduction there. We'll be assisting with some of that as well. And Nikki, I'll get to your question in a moment here. The other team member is Stuart Sloniker. And y'all have worked with Stu in the past. Stuart is going to take over to just run vaccinations and testing side of things, and not really run those things, but help coordinate those with schools. So you'll be involved in a lot of those conversations. Nikki, the answer to the number of 64 confirmed cases started at what date? And that was on July 20th of this month. So 9 days ago. 9 days since the 20th of July, we have 64 confirmed cases. And I'll get to some of those other questions in a minute. Thank you, Dr. Gerald, for posting that in the chat. Okay, so here's our main page. We put our school resources link right up on this front page. So as soon as you type pima.gov, this link is ready to go, and it's back up and facing. A couple of documents I want to show you here. Updated K through 12 guidance. This has undergone some changes since our last meeting. So you'll see right at the top, PCHC strongly recommends that people who have not been vaccinated get the vaccine. We are still expecting under 12 vaccines, potentially down to the age of 5, to start to take place in September. We will continually update you on that statistic. We have not heard anything about booster shots at this point in time. Again, we will keep you updated on that, make very large announcements and celebrations when we know that's available. Last piece down here at the bottom, wear a mask regardless of your vaccination status. You have, I mentioned that a little bit earlier. Yeah, what the best thing to in terms of keeping up to date on these handouts is go to this page. I will drop the web page in the link here so that you all have access to that. How did I get back there? Here we are. All right, so I'm dropping this page here in the chat, and I would encourage you all to save this as a favorite page. This is where you're going to get the latest updates on the documents, because I do think there could potentially be a few more changes coming in the next 2 weeks, depending on CDC guidance and as those guidance pieces change. The other documents that you'll need to know about that are going to be very helpful for you will be the outbreak alert letter for parents and for staff. That's if you have an outbreak at your school, you can just pull this direct from the website. If you have a possible exposure, at your school site. This is a handy letter to have too. This just basically states that there's been a possible exposure. So this is not necessarily, if you're kind of unsure and you're in a situation where you've got a classroom where they're kind of like, well, we don't really know, but they're all in the same room together. You can send that out to parents to let them know that and strongly support and urge them to seek testing. Which brings us to the next piece in line here, which is testing, right? So we can't enforce masks. We can't physically distance, although we would encourage you to continue to try to distance to the greatest extent possible that you can in your classrooms, given all the situational circumstances going on with that right now. The one thing I would encourage you all to do is, if you haven't already, it would be a very good idea to consider pooled testing. Pooled testing is currently being run through the state by Concentric, by Ginkgo, and I do have Ash on the line here with us today. I want, before I bring Ash on to talk a little bit more about how to connect those dots, I want to reemphasize this point that pooled testing and large-scale testing in general are going to be probably the most important tools that you will have to prevent the spread of COVID in your classroom, because it allows you to conduct contact tracing rapidly by identifying positive cases, asymptomatic preferably, because if you have symptomatic students, they should be sent home immediately. Be the biggest arrow in your quiver to identify those asymptomatic cases early and start to move towards contact tracing, isolating cases, and preventing really big outbreaks. So Ash, if you want to take a minute here, unmute, maybe turn on your camera and talk a little bit more about how folks can connect to you.
Yeah, happy to. Thanks, Brian. Yeah, I think I don't need to reiterate, kind of Brian laid it out pretty well in terms of the importance of this. I mean, over the last 9 days, you can already see the number of cases and how quickly they're rising and increasing. So what we've really been doing is exactly what Brian alluded to, just trying to connect with as many schools as possible. And you may have all seen that email that went out a couple of weeks ago, I believe now, really highlighting that this is available to your schools. It's fully funded by the state. It's a ADHS sponsored program. So really it's of no cost to the schools at all. We can provide staffing support. We're trying to make this as easy for schools as possible to really implement. And really we just need one point person on the ground to help coordinate this. Other than that, it's 1 to 2 weeks to get it going. So thinking about, as schools are coming back, the fall semester right around the corner, this is something that we can get started on now and really start implementing, at least putting it in the key pieces. So even if you don't want to start now, I think it's a good idea just to get this set up, get your school set up. So if an outbreak happens or if a number of positive cases come up, now you can quickly turn this on. So what I'll do is I'm happy to connect with any of you offline if you have any detailed questions. I'll drop my email and my phone number in the chat here. And I think there's always some nuanced questions that come up, and happy to connect with any of you and talk through exactly what it takes to get you going.
Great, thank you, Ash. And just a reminder to everyone on the call that this call is being recorded, and we'll post this on the YouTube channel today as well. 2 questions I addressed in the chat there. Any new epidemiologists in our department? Yes, and we are trying to continually boost our capacity. The second piece, of mandatory quarantine periods for students as they return from travel from Mexico. No, there is not at this point in time. And we would not have the jurisdictional authority to enforce that. That would be a state level decision to do that. Sherry, question here, or a statement, important statement. Challenge with pool testing, we are finding is that a good number of parents will not agree to that and not give permission. So if there's a number of students who are not part of the pool, in your opinion, is worth the time and effort to do this. I think if you can get 50% of your student body online, that's 50% more chances of identifying any asymptomatic presence of the virus in your community, and therefore 50% more safety that you can try to issue. That is this piece is a really good conversation point, and something that we as a health department need to try to figure out how to help you do, is communicating the importance of why testing is a community safety issue. I mean, from a public health standpoint, it's easy to communicate that the early identification of cases is critical to preventing outbreaks and massive spread of a virus and what is potentially another wave of a pandemic event here. I think communicating that to your parents is a part where I think in terms of a social currency, you all are going to have a lot more influence upon the parents and the communities that you serve than we will. And if there's a way that you think that we can help you communicate that, we're very open to that. Two other questions, and then Nikki, I'll get to you right after that. Have you heard anything about how schools are managing pool testing? I've heard it can be a huge time commitment, and unfortunately we have limited staff. So Madison, that's a great point. And Ash mentioned that Concentric provides the staff to actually run the pool testing piece. So that's a really important note, is that they do everything for you. All you have to do is help coordinate the logistics of when they show up and who they test and how they go about doing it. And Ash, if you want to comment any further on that, please feel free to.
Yeah, no, I think you covered it, Brian. The nice thing about this program is it's fully funded, including the staff, and really we can provide the administrative staff, which would essentially think of them as project managers that can help you run all of the administrative logistical pieces. And then also, if you want a nurse to come on site to help with maybe collection or helping with the follow-up testing, we can do that too. And again, it's not going to be any additional add-on cost to the school. It's just, you just have to let us know you want additional staff, and that way you can take a lot of that burden off of your school staff.
Thank you, sir. Question of Sherry: if you do pool testing, is true if one is positive, you must retest all who see who is positive? Absolutely, because you want to pull out and identify, because let's say you have the pool test as a whole takes up to 30 individuals and then shows a positive result. If there's any presence of the virus in that classroom, you're going to want to retest with the Binax every individual student to identify who those positive cases are and move them into quarantine, isolation, contact tracing, and case investigation as quickly as possible. Ash, do you want to comment a little bit more about some of the details on that overall process?
Yeah, and the nice thing about the Binax now is that we will send a nurse. The DHS is providing the Binax Now kits to you, which will be kept at the school. So if there is a positive pool, essentially what happens is we'll send a nurse and they'll run that process for you. So really, a nurse will come the day after the pool test. You'll say, hey, Mrs. Smith's grade 4 class was positive. The students will all get individual Binax Now. So within, you can imagine, half an hour to an hour, you'll be able to identify which one of those individuals was actually positive in that sample.
Awesome, thank you, sir. Nikki.
Yes, so you need a signature from a parent. Are you all the ones that collect signatures and sends it out to the families? Do you take on that responsibility?
Yeah, so the school is the one that sends out the consent form. I will say it is a one-time consent that the parents do right at the start of the program, and that covers them for the entirety of the program. And it's one consent, it's a global consent that covers both the pool testing and any follow-up that needs to happen. As part of the administrative support that I was mentioning, if that is something your school needs support with, the administrative staff can actually help you coordinate and manage those consents and organize on the back end, okay, which one of these students has actually consented, and help you organize that student population.
Thank you. And who, So you have this group of 30 kids pooled testing, or even larger because you're in a middle or a high school, and you have a positive test. And so now you decide to do the antigen testing, and you have someone to do that. Who calls all the parents and gets permission of the kids that did not sign up to be tested?
So Nikki, just a clarification, if they did not consent, then they would not be included in the pooled test.
Correct. But if you have a classroom with 20 kids that get tested, the other 10 kids are exposed as well to somebody in that classroom. What do you do with those 10 kids?
So those 10 kids, if you have a positive result in that classroom, those 10 kids would be considered exposed after pending identification of the positive case. If they meet the close contact criteria, you would move them directly into quarantine isolation.
But you would do that because we no longer do that. So that would be the identification and the contact tracing. You would have all that information given to you by this contracted agency. I'm wondering our role in all this, because that's a huge role.
Yeah. So in short, you're like, the role of the school district in this is to host the testing. That's it. All the rest of the logistical details, we will work out with Concentric on the back end. The part that we need help with, though, Nikki, that we won't be able to do is once we do identify who needs to move into quarantine, we'll develop the letters and we'll send them to you, and we'll snail mail them out to the parents. But that's going to take 2-3 days for them to get the letter to us. So, you know, I mean, this stinks. It's not fun, but we have to try to prevent this in whatever way we can. And if you have a positive case at your school site, we are relying on the schools to pass on that email letter or that physical letter that we generate for you to those positive cases and to the close contacts to initiate that process of getting them into quarantine.
Okay.
Does that clarify?
Somewhat.
Okay,
To me, it sounds like a huge amount of work for one person per school, one healthcare worker. And I want to just make sure that I'm from TUSD, by the way. And if we take that on, I want to make sure that we don't have angry parents for getting a letter when they didn't even agree for their child to be tested in that group.
Well, they wouldn't. Those kids wouldn't be tested, though, Nikki. That's what I'm saying.
But they're still going to get a letter saying your child is a close contact and you probably need to quarantine.
Yeah, and we have the legal authority as a health department to do that. So when they call TUSD, you can say this is the health department law, and this is the jurisdiction agency behind that. This is who you're going to need to call, and you can deflect.
But we send out all the paperwork to the families, correct?
Via us. We have the authorization to distribute it. Otherwise, you're going to have 3 days with positive cases in your classrooms, and you're going to have to shut your school down. Which, if that's the path that the district wants to take, like, you know, I mean, we're just trying to figure out how we can best support with the constraints that we all have right now.
I think it's a great idea if we have the manpower support to be successful.
I would totally agree with you. Kathy, I see your hand up.
Yeah, I'm just kind of tagging on to what Nikki was saying as a fellow TOSD person. So I understand how the process will work and that there's support, and that then you would then contact family members of people who had children in the classroom where we had a positive case to let them know that they may be that there's a close contact. I just want to verify that my understanding of how far you can go with quarantining, that I have a correct understanding, which is you can strongly recommend that the child be quarantined. But if little Johnny shows up the next day, there's nothing else we can do. Is that correct?
That is correct. Unfortunately, that is correct. So, you know, some of the strategies that we're trying to figure out, given that you now have full classrooms and no spare room, is what do you do when you have that situation with 10 kids who have been told that they need to quarantine or that they need to isolate because they're a positive, and they still get taken to school and dropped off. Because I can tell you that the county will not pursue legal action in that case. So, I mean,
I guess my question is how far, last year when basically we were working with you and telling people, you need to quarantine your child.
Yeah.
We kind of there wasn't a lot of wishy-washy language. And although people were not happy, people didn't drop their kids off, or if they did, we called them and they came and got the child.
Yeah.
If we can't do that now, are we forced to keep them in the classroom? Because I have a horrible feeling if we pull them out, then we're being discriminatory. Are we supposed to come up with an alternate space if somebody sends little Johnny back into school? Are we supposed to just leave them there and tell everybody put your mask on? What do we do?
That would be ideal to have an alternate space, but we don't have a strategy to help resolve that at this point in time. The alternate space is the thing that we've been discussing, but the counterpoint that I keep raising is there is no alternate space at a lot of these schools.
Correct. And I'm not sure that wouldn't get us into trouble, that we're discriminating again, that we're not going to be right back to all of that we're treating people differently.
Well, I do think you can use the health statute of authority to do that, right? Because we do know that if it's a positive case, that there has to be a level of separation in order to prevent further spread in public health crises. So,
okay.
And I think Nikki and sorry, my brain is not working right. Nikki and Kathy, let's have a call a little bit later today and just kind of work out some of these details, because I think there may be some unique challenges to your district that we can try to work with you on. Will that work for you?
Yeah, just let me know. I may have something after 2:00, but other than that, I'm wide open.
Okay.
And if worst comes to worst, you can just knock on my door.
Okay.
So.
And I do appreciate the questions too. Sherry, if you do pool testing, is it true that one is positive, you must retest? Yeah, I addressed that one earlier. If you run a Binax and get a negative result, you'll take that result and not send them out for further PCR tests. Correct. We changed that guidance last year. So if you get a negative Binax result, the health department will now take that as a negative test result. And I did see your comment later, but you no longer need a PCR for verification. Comment from Christy. Yeah, thank you for that comment. Is Pima County Health Department planning to shut down schools with a number of positive cases this year? We will shut down classrooms after a certain percentage has been met. Right now, we're looking at around 10% of the classroom. And that's going to be a trigger point, but we're still in some detailed discussions about what that actually looks like. As for schools, we have yet to determine that criteria. We had criteria last year that was 10% or 3 or more outbreaks within a set period of time. Those discussions will continue, and we're trying to figure out what our legal authority is based on the new guidance that was released from the state. So we will have that guidance for you by next week. And if not, then I don't know what we're going to do. If schools get parent consents, Concentric does the pool testing. Yes, if positive tests, Concentric and school work together to report positive case. Concentric actually helps to report that positive case to the health department. And then the health department does all the contact tracing. But what happens is in between there, with the positive case and any close contacts that are identified, we coordinate with the school to get letters to you electronically that you can then help distribute out to the parents of positive cases and close contacts. Last question, 12 and under, how could they be discriminatory regarding quarantine mandate from a school since none of those students are vaccinated? I think there's a lot of legal questions there that go way above my head on all of this. And Sherry, I saw your hand go up earlier, so if you have another quick question, we can address that. Okay, I do want to do a quick screen share because I do want to talk about contact tracing and what that entails, because I know that some of you are already getting contact tracing questions from parents. So I will forward this PDF document. It's a poorly transposed copy, which was a quick scan and loading in, but this is a document we have that just outlines what contact tracing is and what that looks like. Some of the things you're never going to be asked a credit card number or for a social security number or anything like that. you'll get a call from Public Health or Pima County Health. There'll be a 520 area code. If those things happen, all those calls are private and confidential. We don't share that information with anyone. We do use aggregate data on the back end for analysis to generate reports like the one that I gave at the beginning of this call. But it's a really critical piece to help prevent spread of COVID. And I know, Dr. Hagerman, you had a couple of questions on that. I want to just make sure that that flyer or the statements that I have addressed some of that.
I think so. I don't know if Marie is on. She could ask if there's any more, but we just had parents come back, sometimes confused post contact tracing, and then come to us for clarification, and we don't necessarily know what happens and how to navigate that. Okay,
cool. Well, we'll keep that technical assistance line open. We're boosting that communication as well. So you can always defer parents to that number. That number is found right here, 724-7018. I'll drop that in the chat. I'm building out a whole team along with a whole response for that will be giving report outs as well, because we're seeing increased volume on that call line right now as well. So feel free to direct parent concerns, questions that you can't answer to that number for everyone on this call. Last couple things that I wanted to touch base on. You saw the letters. Again, I want to reemphasize the school reporting process is going to change. We're going to try to move away from the Qualtrics form as it currently exists. Our goal is to make this a little bit easier for you and faster. If you have over 20 close contacts currently, send us an email, call me, do something. I'm going to send you a KiteWorks email, and then you can just forward an Excel document with the information we need as you've gathered it over to us. The training video will change because the reporting will change there. Data reports is the last thing I want to change. So we do have this, this kind of tracking data piece flushing out. There's some important things that we're seeing changing. The hospital bed capacity is changing statewide, not just for us, and I would say potentially nationally too at this point. We are seeing in terms of progress, this just means that it falls within a level of percentages. So one of the issues with this is that we are quickly moving down the scale with the cases, the caseload, and the percent positivity as well. We are reevaluating COVID-19 like illness, and this is something we could use some help from you all with. If you have an automatic way that you generate attendance percentage reports at your school sites for your district or for your individual schools, we'd really like to connect with your district administration that collect that information. We've heard that there is higher percentages of absences due to sickness being reported in schools right now that are currently operating, in summer schools that are operating, athletic sports, anywhere from 10 to, in some cases, 16% of student bodies calling out sick with symptoms, including fever, vomiting, things of that nature. So we would like to look at a lot of that information. Our goal is to try and make a case for masking, so that there's some things I can't talk about on this webinar here today, but that data set would help us out in that case. So please contact me via email, brian.eller@pima.gov, if that's a resource that you know how to connect us to. The last data source, just a reminder that this chart exists here on the health department. It's great to access overall. You can get cases by gender, zip code, ethnicity, age group, and cumulative cases. And each one of these pop-outs that you generate, you can do by date and then adjust the date range to meet a specification of a request as you're looking at it. Please remember that these cases are based off of MedSys numbers, and that typically can take anywhere from 8 days to fully populate the data set for a given day. Okay, so just other important information to know when looking at some of this data as it's reported. So there's a bit of a lag on this interface. On this webinar, we'll try to give you up-to-date information as quickly as possible. One last question I want to address. Oh, there's a couple others actually, sorry. And Ash answered that, Lynn, so I'm going to call those out. Dr. Gerald asks, how often are you recommending that pooled testing for schools? We would recommend once every 2 weeks would be a really good place to go, but ADHS is recommending pooled testing once per week. However, there is flexibility in the program where you can scale that back to once every 2 weeks. You work with what feels best for your school. If contact tracers sent an email to parents, would it be possible for us to get a copy of that email? That way we can reiterate the same info. I don't think so because of HIPAA requirements on that one, Nurse Baca. But what we can do is we can figure out some line of communication. If there is a parent that calls you or has some concerns, maybe that can trigger a response where then when we have contact tracers reach out to that individual again. So we're kind of closing a loop on communication there. So that's something additional we may put into our phone response. All right, so we're 5 minutes past the half hour here. I have gone over time. I do appreciate your time and attention and questions. Most of all, I just want to say that this is I perceive that there's a lot of fear in the community right now, and especially in regards to schools. I hope that you view us as an asset, as an ally, and someone that we can kind of stand together and continue to work together in the way that we did last year. So you all have my cell phone number, you all have my office number, you all have my email. I do want to state that between the hours of 6:30 and 9:30 every day, I'm calling a hard stop to be with my family, and I'm not available on Sundays. That was not the case last year, but I do have to put those boundaries down. If you contact me during those hours and it's an emergency, let me know, and I can get back to you after 9:30 on a daily basis. So just type in, text me, say emergency, and I will make sure to call you that evening, okay? That's it for today. Thank you all for attending, and Nikki and Kathy, I will definitely make some time to follow up with both of you today. Thank you all for your hard work and keeping our students safe. Have a wonderful day.